Hello, today we're going to explore Irritable Bowel Syndrome, or IBS, an often misunderstood condition that affects millions worldwide. This comprehensive guide will help you understand the different types of IBS, how to differentiate it from other serious conditions, and what steps you can take to manage your symptoms effectively. IBS is a functional gastrointestinal disorder that affects the large intestine. It's typically categorized into three types: IBS with constipation, IBS with diarrhea, and IBS with mixed symptoms. Unlike inflammatory bowel disease, such as Crohn's disease or ulcerative colitis, IBS does not cause inflammation, ulcers, or permanent damage to the intestines. This is a crucial distinction because while IBS can be uncomfortable and impact quality of life, it doesn't lead to more serious conditions. Differentiating IBS from IBD is vital. In IBD, patients often experience significant weight loss, rectal bleeding, and persistent pain, which are less common in IBS. Diagnostic tests like blood tests for inflammation markers, stool tests, and a colonoscopy can help rule out IBD. If you're experiencing severe symptoms or if you have a family history of IBD, it's essential to consult a gastroenterologist for further evaluation. IBS presents with a variety of symptoms depending on the type. IBS with constipation is characterized by hard, lumpy stools and infrequent bowel movements, while IBS with diarrhea involves loose, watery stools and frequent urges. IBS with mixed symptoms features a combination of these symptoms. Diagnostic testing often includes a thorough review of symptoms, blood tests to rule out anemia or infection, and a stool test to check for any signs of infection or inflammation. Section 4. Treatment plans. For those with IBS-C, increasing fiber intake through supplements or foods like fruits and vegetables is often recommended. Osmotic laxatives can help by drawing water into the colon, making stools easier to pass. For more severe cases, medications like linaclotide or lubiprostone may be prescribed to increase fluid secretion in the intestines, easing bowel movements. In IBS-D, anti-diarrheal medications like loperamide can help manage symptoms. Bile acid binders are another option, especially if diarrhea is triggered by bile acid malabsorption. Probiotics, which help balance gut bacteria, may also be beneficial. It's important to stay hydrated, as frequent diarrhea can lead to dehydration. IBS-M requires a more tailored approach, combining elements from both constipation and diarrhea management. It's important to monitor symptoms closely and adjust treatment as needed, often with the guidance of a healthcare provider. One of the most effective dietary strategies for managing IBS is the low FODMAP diet. This involves reducing intake of fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which are types of carbohydrates that can trigger symptoms. This diet should be followed under the supervision of a dietitian to ensure nutritional balance. In addition to the low FODMAP diet, paying attention to meal timing and portion sizes can make a big difference. Smaller, more frequent meals may help ease symptoms. Also, avoid common triggers such as caffeine, alcohol, and fatty foods. Stress management is another crucial component of managing IBS. Techniques like mindfulness, meditation, and regular exercise can help reduce stress and improve overall gut health. Adequate sleep is also essential, as poor sleep can exacerbate symptoms. IBS doesn't just affect the gut, it's closely linked to mental health. Anxiety and depression are common in those with IBS, and stress can significantly worsen symptoms. Cognitive behavioral therapy, CBT, and other gut-brain axis treatments have been shown to help by addressing the psychological aspects of IBS. Incorporating relaxation techniques and seeking support from a mental health professional can be invaluable in managing the condition. Managing IBS effectively requires a personalized approach that addresses both physical and mental health. By working closely with your healthcare provider, you can develop a comprehensive plan that includes dietary changes, medication, and lifestyle adjustments. Remember, if you experience any severe or concerning symptoms, it's important to consult with a gastroenterologist to rule out more serious conditions. Thank you for watching, and take charge of your health today. Disclaimer. The information provided in this video by MD Talk Health and Fitness is for educational purposes only and is not intended as medical advice. United Medical Group, YourMD.Online, LLC, and the doctors who narrate these videos are not responsible for any harm or problems resulting from the information provided. The doctors narrating these videos are providing educational information only and do not represent their practice or their professional decisions. No doctor-patient relationship is established through this video. Please consult your healthcare provider for personalized medical advice.